What solutions do you have for chronic pain management without medication?
That's the reason that we get most of our patients. We're very big on not adding in another medication. Nobody wants that. And there's not a lot of great medications to use. So what we use is, I'm going to just hold this up. We use a little machine that we hook up to your feet or your hands where you're having the neuropathy, and it sends a little electrical pulse or stimulation directly to the neuromuscular junction. And what we hope to do is interrupt that bad signal, that signal that's coming from your feet up to your brain that says it's numb or it's dull, it doesn't feel right, or it's painful. So we use that to interrupt that cycle, just to stop that message. And our hope being that we re-educate that neuromuscular junction, if you will, to send up the normal signal again. So what our goal is to make it be the right signal to the brain. That stops some of the pain. It helps keep the neuropathy from progressing and getting worse. We know that when you have pain, everything else falls by the wayside. You feel bad all the time. There's not anything that really treats it. There's not a drug that you can take that takes that pain away. Things that do work tend to be really sedating. That makes it less safe for you to be walking around with your neuropathy. So if we can use a machine to decrease your symptoms and give you a little bit of relief, then that's all to the good. We usually start out doing treatments twice a week for 3 weeks. We try 6 treatments, and people will come back and say, oh, it felt great while I was doing it. It lasted maybe an hour. It felt pretty good. Then by the end of that 6th treatment, they come back and say, you know, I got a couple of days out of it. It felt pretty good. I think I'd like to do another treatment. So we reevaluate, and then we will sign up for another 6 treatments and keep going there as long as they're getting better, as long as they can show us that I feel better, I'm having less pain, I sleep better, I'm not thinking about the pain all the time, I'm not grouchy, everything's a little bit better, then we go full speed ahead. Some people will only need those 12 treatments. Some people will go on for a much longer time period, and it kind of depends on how long they've had the neuropathy and what the cause of neuropathy is. If your neuropathy is because you drink too much alcohol, we reverse it. You quit drinking, we're done. We part ways and say fine. If your neuropathy is for long-standing diabetes and your diabetes isn't under control and you're always bathing those neuromuscular junctions in high sugar, that doesn't get better very well. If you get your sugars under tight control, if you start to make things better, take good care of your feet, and we keep doing treatments, we can get some control there. We can get some good improvement.